If you can't sleep, then you need to watch this. Hello and welcome to another edition of the Ask Dr. Pickel Show. All right, so today we want to talk about sleep and what will be called my top 5 when it comes to sleep. So watch closely when we go over this, and let's dive right in. So the first one, top of the list, is going to be melatonin. Most people have heard of melatonin. Melatonin is an amazing hormone that our brain makes. Actually, it's an area in our brain called the pineal gland. Now, sometimes if people have gut inflammation, brain inflammation, other health issues, this could compromise melatonin production. And I would recommend, taking melatonin. I usually like the sublingual liquid form that absorbs sublingually, so it goes straight into your bloodstream, then it doesn't have to pass through the liver. Though some people do better with capsules or sometimes extended release capsules. So it varies per person. And the great part about melatonin, despite all these myths out there, is it's the only hormone that has no toxicity. It has no dependency that can get built up on it. It is not a problematic thing to take. So it's only going to help. All right. The next one on the list here too. Now let's go back to that melatonin. Some people, and these won't all work for you. Some may work. Sometimes a combination may work. Some people do fantastic with melatonin and it changes their life. Some people need other things. So just to kind of preface all of this. All right, so the next one on the list here is the magnesium glycinate. Now, what am I, magnesium? Are my bowels going to be moving a lot? Is this going to give me diarrhea? No, this isn't magnesium citrate, magnesium carbonate, these bigger molecules that move the bowels. This is magnesium glycinate, teeny tiny molecule of magnesium. This is the kind of magnesium that comes from food. So the thing is it will actually go into your bloodstream. Now, what does magnesium do? Magnesium helps increase the way GABA gets into your cells. It actually kind of primes your receptors for GABA, meaning that in order for GABA, which is a neurotransmitter in your brain that lowers anxiety and helps you to sleep, that neurotransmitter has to get into your cells through a little doorway. And magnesium helps to keep that door open to allow that GABA into the cell better, is the best way to put that. So it does help with GABA, usually about 500 to 600 milligrams here is what we're looking at. And, some people do fine on one of these. Some people are like, hey, I took one. Boy, that just did it for me. Some people it's 2. Some people it's 3 or more. I've seen it take a few sometimes, especially if you're really low, but this does affect GABA. Now, magnesium is also tied into the manufacturing of other neurotransmitters like serotonin, but probably the most research benefit is the way it affects GABA. Now, the next one, number 3, 5-HTP. What is 5-HTP? Well, it's the precursor to serotonin. So serotonin also we need to help with sleep, and it turns into melatonin. So we really do need our serotonin levels at a good level. Now, I would say, though, if you are taking antidepressant medication, you may not be able to take this. 5-HTP can be great. Now, some people do great with 5-HTP. Some people do great with its precursor. They'll take just straight tryptophan. Again, about 75 milligrams of 5-HTP at around bedtime or 30 minutes before. Some people, this just knocks them out and keeps them asleep. But again, we're trying to affect serotonin here. The next one, valerian root. Actually, it's affecting the same thing, serotonin. Some people swear by valerian root. They'll take about 300 milligrams, whether they take it in a tea and drink it or take capsules. And they'll do that about 30 minutes to an hour before bed. And again, helping serotonin raise up, helping you fall asleep and stay asleep. Valerian root has a long, really interesting history. All right, the next one, CBD oil, cannabinol. So wait a second, isn't this a drug? Will it cause me problems? No. CBD is made from hemp, which has no THC. So this is not a problem. This is, again, something you want to take about 30 minutes, an hour before bed, 20 to 60 milligrams. It's usually in a liquid form. Some people will put it in something and drink it. Some people put it sublingually. It does decrease cortisol and anxiety. Many people love this, and it just really puts them into a deep sleep. Again, some people, it's also, like I said, a combination of these things. So let's also go to a couple of other tips and information here that may help. All right. So another one, here's a couple more that I didn't mention in my top 5 that some patients do great with these. Passion flower tea. Some people love this and also swear by it. They'll drink their cup of passion flower around bedtime and it just knocks them out. Lithium orotate. This would be tougher cases that aren't responding to anything else. Sometimes they will try about 5 milligrams of the lithium. Again, if you're on certain medications, you may want to talk to your doctor about this, but lithium has effects on the brain. It also can help with sleep and decrease anxiety. Then here's a very important factor. Take B vitamins. If you're having problems with sleep, it means you're probably not making enough neurotransmitters in your brain, such as GABA, such as serotonin. These are the 2 neurotransmitters that are especially involved with sleep, involved with lowering anxiety. And in order to make these neurotransmitters in the brain, you have to have decent levels of B vitamins in your blood. Now, many people take the B complex and they'll get all they need, but there's a lot of people who don't absorb vitamin B12 very well. So sublingual B12 would be the way to go with this. And again, I'll tell you, a lot of people, they'll take the B complex once during the day. The sublingual B won't notice a difference, but they'll step it up to 1 at breakfast, 1 at lunch. Game changer sometimes. The other side to this, though, is don't take these too late, because if you take them in the late afternoon or evening, they could keep you awake because they are stimulatory. The great part is they're water soluble, so your body doesn't store very much of them. And so there's no real toxicity to them at all. If your doctor is looking at blood tests for like B12 and they test your B12 and it says high or normal, it's a bunch of baloney that fluctuates on the blood test. They would have to have tested methylmalonic acid. So disregard if that's been tested. All right. Blood sugar support. Here's very important. In order to fall asleep or stay asleep, you have to have decent blood sugar. Your adrenal glands have to be working well. And so what's going to happen is if you have low blood sugar issues, you're on the hypoglycemic side. Maybe if you go too long between meals, you get shaky or headachy, or you feel tired, or there's a lot of symptoms there. But the thing is if you eat dinner at 5 and you don't go to bed till 11 and you don't eat till then, this can be a problem for you. What's happening is your adrenal glands are having problems. You could be releasing adrenaline, epinephrine, norepinephrine, and this will keep you awake or wake you up during the night if your blood sugar drops while you're sleeping. This means you have other underlying issues probably affecting your adrenal glands, such as infections or something causing inflammation in your body. If you have high blood sugar, if you're diabetes type 2, insulin resistance, pre-diabetes, metabolic syndrome, then yeah, if you're high blood sugar, then you're probably making way too much cortisol, and this could prevent you from falling asleep at night, and that could be a factor for you. And then if you have low iron, this is an extremely, extremely important thing. And don't let your doctor get away with just testing your hemoglobin. Say, I want my iron and my ferritin tested. And if those are low, then yeah, you can't make neurotransmitters in your brain without iron. So if you're iron deficient, even some, or if you're in full-blown iron deficiency anemia, this is going to affect your sleep. Between that and blood sugar, if those are low, you got to get those fixed before anything's going to work properly. So very important to look at that. And also, if you have more of a chronic issue, if you've tried all these things, if you're like, doctor, I've tried all these supplements, I've got chronic fatigue syndrome, myeloencephalitis, none of it seems to be working, then you need to be looked into further. And typical blood tests, medical tests are not going to do this. We've got to use more like bioresonance testing, things like that. We need to find out, do you have Epstein-Barr virus? Do you have cytomegalovirus? Antibodies for those things don't always show up on blood tests very well at all. And if you do have those, yeah, they're going to make you tired all day and unable to sleep at night. The thing is, though, is if you have those, then we've got to say why, because an adult immune system should easily be able to zap these viruses. So if you have them, we've got to say what's underlying that. Lyme, heavy metals, chemicals? What is compromising your immune system that's allowing this in the first place? And really, with a lot of chronic sleep issues, we've got to find out the whole picture, the big picture, if it's persisting. All right, because sometimes it's just stress and you need something quick and easy to help you get sleep that night or a few nights until the stress decreases and goes away. All right, hopefully everybody got some great information on this. There's another video that I think will be very helpful with this, and then I'll put some links for the other videos that relate to serotonin and GABA, because those are also helpful. But I hope everybody has a wonderful day. God bless, and I'll see you next time.